Hello, good morning everyone. This is Peter J. Jacob again, your infection control preventionist of Dr. Sulaiman Al-Habib Hospital. Okay, for today, I'm making another video as a follow-up from a previous video, which is the standard precaution. For today, we're going to discuss about transmission-based precaution. What is transmission-based precaution? Transmission-based precaution are the precautionary measures that are being observed by all the healthcare workers depending on how a disease is being transmitted. It could be either through contact, droplet, or airborne. Okay, of course there are other several ways how disease can be transmitted, but we're going to focus on contact, droplet, and airborne. Let's start. Let's start with contact precaution. Contact precaution are the precautionary measures that are being observed for those diseases that are being transmitted through mode of contact. When we say contact, the diseases are being transmitted either direct touch. When I touch the patient directly, I can acquire the infection. Or when I touch the patient indirectly, when I touch the patient surrounding, the frequently high touch areas like the bed, remote control, curtains, bedside rails, I can acquire the infections. What are the example of contact diseases? Number 1, scabies. 2, conjunctivitis. 3, pediculosis or body and head lysis. 4, most multi-drug resistant organisms like MRSA and Clostridium difficile are being transmitted through contact. And because these diseases are being transmitted to contact, you will be needing the following PPEs: gloves, gown, and hand hygiene. Because the disease is being transmitted only through touch, that's why you only need gloves, gown, and hand hygiene. And no need to put the patient in a negative pressure room. A single room is already allowed for or advisable for the patient. Now let's talk about droplet and airborne. Both type of diseases are being transmitted through droplet nuclei that are suspended in the air. The only difference between the two are the size of the particle. For droplet, the size is greater than 5 microns. For airborne, the size is less than 5 microns. Now, let's set aside airborne. Let's focus first with droplet. Okay. Since the size of the droplet for this type of diseases are greater than 5 microns, they are much bigger. Okay, and when you are much bigger, you are much heavier. And when you are much heavier, you can travel only through short distances, approximately 6 feet. That's why whenever we're having patients like this, we need to observe as much as 6 feet distance to these patients. What are the example of these diseases that are transmitted through droplet? Meningitis, pneumonia, influenza, RSV. Okay, these are the examples of diseases that are being transmitted through droplet. Okay, and since the droplet can only travel in short distances, approximately 6 feet, there's no need for you to put the patient in a negative pressure room. A single room is advisable for the patient because after the 6 feet distance, the droplet from the air will fall down on the environmental surfaces. Since the droplet for this type of diseases is greater than 5 microns, a normal mask is enough for this patient. Okay, so what are the PPEs that you need to wear? You need to wear gloves, gown, normal procedure mask, and face shield and goggles. Now let's talk about airborne infections. Okay, when we talk about airborne infections, these are the type of diseases that are being transmitted through airborne droplet nuclei. And the size of the droplet are much smaller than the droplet by nature. The size of the particle is less than 5 microns. And when you are much smaller, you are much lighter. And when you are much lighter, you can travel through air current. Okay, this is the reason why we need to put these types of patient in a negative pressure room because the droplets can travel through air current. So a negative pressure room or a single room with a portable HEPA filter is necessary for these types of patient. What are the examples of these diseases being transmitted through airborne? Number 1, tuberculosis. 2, chickenpox. 3, measles. Okay, those are the examples of diseases. Of course, there are other diseases that are being transmitted through airborne also, but it's more complicated because it's a mixture of contact, droplet, and airborne, and we're going to discuss those things or those diseases later on. So since the size of the droplet is less than 5 microns, a normal procedure mask is not enough for this type of diseases. You need to use a specialized mask, and we call this mask as Respirator Mas, the very well-known N95 mask. Okay, so what are the PPEs that you need to wear when you're dealing with patients having airborne infection? Number 1, gloves. 2, gown. 3, N95 mask. 4, goggles and face shield. Let's talk about a more complicated disease like the MERS-CoV and the very well-known now the COVID-19 and H1N1 and SARS. Okay, by nature, these type of diseases are droplet in nature. That's why if the patient is stable, we need to observe only droplet precaution for this type of patient. However, if the patient are critical and you are anticipating an aerosol generating procedures to be done for the patient, you need to observe airborne precaution. Okay, I mentioned about aerosol generating procedure. What are those procedures? These are type of procedures that produces very small droplets, same like an airborne droplet, same like a size of less than 5 microns. That's why when you do aerosol generating procedures, especially for this type of critical patients, you need to observe airborne precaution. What are the examples of aerosol generating procedures? Number 1, suctioning. 2, CPR. 3, nebulization. 4, simple as intubation. Nasopharyngeal swab. Chest physiotherapy are examples of aerosol generating procedures. Things that you need to take note regarding this discussion. Number 1, the difference between standard precaution and transmission based precaution. Standard precaution are the precautionary measures that are being observed by the healthcare workers regardless of the case of the patient, regardless if the patient is communicable or not communicable. On the other hand, when we say transmission-based precaution, these are the precautionary measures that are being observed by the healthcare workers depending on how the disease is being transmitted. It could either be contact, droplet, and airborne. So let's take it in a scenario, okay? Initially, if for example you are an ER nurse, you will receive a patient in the emergency room. So your initial precautions that you need to observe to the patient are standard precaution. Okay? And then after 10 minutes, you suddenly assess the patient. And then you notice that the patient has fever, difficulty of breathing, and coughing. So aside from standard precaution, you need to apply airborne precaution. So the precautionary measures that you are observing for these patients are standard precaution and airborne precaution. Number 2, okay, whenever you're handling patients having communicable diseases, it's very important for you to apply, you observe the transmission-based precaution cards. Actually, these are color-coded, okay, red for droplet, blue for airborne, and green for contact diseases. These transmission-based precaution cards should be posted at the door of the patient. This is to give an information for those people or healthcare workers that are entering the patient's room that this patient has a communicable disease and that they should follow precautions. Okay. Aside from the transmission-based precaution cards that are being posted to the door of the patient, you need to apply the transferring cards, the small one. It's also color-coded. Okay, you're going to put the color-coded cards in the patient's wheelchair or patient bed or stretcher when you're transferring the patient from one area to another. It has the same color, red, blue, and green, depending on how the disease is being transmitted. This is to give an information or awareness for those people who will receive the patient from another area. And it's very important that you do proper endorsement. Before you transfer the patient, you need to call the area that is going to receive the patient that this patient has a communicable disease, and it should be reflected in the nurse's notes as well. So there you go. So I hope you understand the transmission-based precaution and you're going to apply it in your everyday duty. So have a great day and see you on my next video.